Welcome to the Healthy Habits for Active Aging podcast with your hosts, physical therapists Dr. Michael Gorman and Dr. Lauren Bennett. This podcast will discuss a variety of health-related topics focused on educating the aging adult, allowing for an active lifestyle no matter the age. Don't forget to rate, subscribe, and share. Enjoy the show.
Hello and welcome to another edition of the Healthy Habits for Active Aging podcast. My name is Dr. Michael Gorman.
And I'm Dr. Lauren Bennett.
And we welcome you to our 15th episode. And this is a very special episode because, as you know, we've been podcasting for the last couple of months. We've so enjoyed it. And now we're doing this via Zoom, which allows us to put our podcast up on YouTube. So obviously, if you're in the car, put the podcast on. But if you're at home and you want to see us talking and making fools of ourselves, please, you can go to our YouTube channel and you can find us there. But today we're going to be talking about something that is so common in today's world and has been for quite a while. And that's lower back pain. Lauren, you want to talk just a sec about lower back pain?
Sure. First of all, lower back pain, it's super prevalent. 80% of people will experience lower back pain at some point in their lifetime. And sometimes you experience it. Most people, like 90% of people, don't even know what caused it or why it came on. Most of the time, usually within 6 weeks, it can tend to go away on its own, but sometimes it does tend to linger. So more than 3 months at that point, we would consider low back pain to be chronic. And Dr. Gorman and I would recommend looking back at a prior podcast a couple episodes ago on the neuroscience, pain science of chronic pain for people when your pain turns chronic. But
yeah, absolutely. It's, we talk about after 6 weeks, most of the inflammation, really probably sooner than that, most of the inflammation should be gone. But the thing is when we have inflammation and pain, we stop moving as much. We have less physical activity. So all those things combined will lead to somebody having chronic pain. It may not happen the first time you get lower back pain, but as this begins to accumulate, each time it comes back, it seems to stay with you for a little bit longer period of time.
Yeah, and people that do experience that acute low back pain, like less than 6 weeks, 25% of those cases actually turn out to become chronic low back pain. And really, of like 60 to 80% of people who experience low back pain at some point will have recurrent back pain within the next 2 years. So we really want to share with everyone today some common causes, some treatments, some prevention ideas so that you do not have recurrent low back pain come back. But like Dr. Gorman said, we'll talk about the importance of movement. Like 50% of people that have low back pain have a sedentary desk job. For what we recommend, is movement good for you? And so we'll get to that in a few short minutes here. But the bottom line is yes.
All right. We're going to talk about some common causes of lower back pain. There's many. There's not just one. Most times when you have lower back pain, like we said earlier, there's not just one reason, one cause. But rapid weight gain is one of those. Rapid weight gain will put more stress on our entire body, our knees, hips, our spine, especially in men. When we gain weight, men tend to put it on in their abdominal area. More weight in the abdominal area will lead to more stress back in our lower back. But by the way, we forgot to tell everyone what you like these fancy words. What's the fancy word for low back, Lauren?
Lumbar.
Okay. I can count on you for putting those good fancy words out. Next thing, and this is although it's probably not as common in today's society as it was 25 years ago, but smoking. Smoking restricts oxygen to the different tissues of the body. When we talk about a disc in the lower back, there's no direct blood supply to a disc. So if you're smoking, you're cutting down on the oxygen even further that's trying to get into that disc to help it to stay healthy.
Yeah, absolutely. Essentially, your discs become dehydrated and lose their disc height, which kind of brings us to our next topic, which is degenerative disease, which is just a really long name, and I like to just narrow it down to DDD. But essentially, it could be from smoking, or just over time. Maybe you have a job where there's a lot of compression over time, where you're always walking with like weights on you, a backpack, or heavy tools. I mean, it really doesn't matter at the end of the day, but essentially what it is that you're losing your disc height in your spine and your vertebrae, and you need height and nice hydrated discs to maintain these spaces between these holes in your spine called foramen. And then there's nerves that run in there. So if you think about your spine decreasing in height, those spaces are become just less and more narrow, and those nerves don't have enough wiggle room, and then that's when you end up with nerve problems like numbness and tingling down into your legs, which kind of goes into another topic we'll get to in just a minute as well. But not to go on a long story about that, but smoking is bad. There's modifiable risk factors of things of the spine, and things that we can control essentially is what that is. So like Dr. Gorman said, if we can control our weight, exercise, eat healthy, not smoke, we're going to be doing ourselves a favor.
Yeah, there's a couple spine surgeons I know, and I'm sure there's many more out there that I don't know, but they won't do surgery on the low back patient or the neck patient. They won't do surgery until that person stops smoking for a period of like 2 or 3 months. And that's exactly why they want to have, if they're going to operate on someone's back, they want to have a good outcome. And they know if the person is smoking, they'll have a less successful outcome. So. But also, we got to keep in mind that genetics is, we for better or for worse, we are who our parents are. We inherited those genes. So if your mom or dad has a terrible low back, there is a chance that you're going to inherit that. That doesn't mean you need to give into it and you're doomed to a life of pain, but just be aware that who your parents are is more than likely, to a certain extent, what you're going to become as well.
Yeah, definitely. I mean, there's some genetic conditions out there where people may be more prone to having a stiff spine. So if you know that the last 3 generations of your family have had arthritis and very stiff or a very forward stooped posture, well, knowing that at a young age can really, really help you to seek out a physical therapist or a doctor, to work just on exercises. Yoga, we'll talk about that, is really good, just to keep you flexible. Use it as a preventative measure before one day you're like, what's this numbness and tingling in my hand or my leg? And now you're kind of working backwards at that point.
Yeah. Everyone, I'm sure, Dr. Bennett has heard of ruptured disc, bulging disc, herniated disc. Really, when you think of the realm of discs, we think of a bulging disc as being a disc that's, for lack of a better term, just kind of sticking out, maybe putting a little bit of pressure, slight pressure on a nerve, or just the outer layers of that disc being irritated. And then you go to herniated, ruptured disc, and that's where the material within that disc is actually protruded out, and then you are getting nerve irritation, or maybe even worse, nerve compression. I have in my notes here that you prepared, so I know they're absolutely right, but 4% of people will have nerve pain from a bulging or ruptured disc. So I thought it'd be higher, but I would never doubt anything you prepare.
I would like to add a little blurb about this too, is I think it's important to remember, like Dr. Gorman explained, like a bulging disc is like your spine, one of the segments could be a little bit forward or back to the other one. The herniated disc is when the disc is like, I think of a jelly donut, is actually pushing into the nerve. But I would like to say that sometimes you may have this and not have symptoms. Like he said, only 4% of people may have nerve involvement, which is typically when a patient will start feeling the issue. And then they'll go to the doctor and they'll think like, oh, I don't know when that happened. I don't remember doing anything. You could have had this for months or years until it got to this point. So don't drive yourself crazy thinking like, what the heck did I do? It's kind of hard when we see patients trying to like talk them back off a ledge, basically, of trying to say what happened exactly. But you can live a very normal lifestyle. If a doctor tells you you have a bulging or a herniated disc, that does not necessarily mean you're going to the operating room or to be afraid to move. You can live a very safe, healthy lifestyle.
Absolutely. Absolutely. Another cause of lower back pain, which is totally within your capability to fix, is improper lifting mechanics. So I tell everybody, when you lift something, whether it weighs a pound or 100 pounds, the biggest thing for me is to keep the weight close to my core, close to my body. The further you reach away from your body, the more stress is going to be placed on your lower back. You've got a longer lever arm, the further out you go. So whether you're picking up a baby, a box, an apple off the floor, a 100-pound dumbbell in Lauren's case, you need to make sure that it's close to your body, and your body will do a good job of that. But once the weight starts to get away from you, it gets harder.
And we will have a future podcast episode on proper lifting mechanics. Now that we're using the YouTube video, we will let you know when that is happening, but it'll be so much easier to visualize rather than just hearing our voices over the audio podcast.
For sure, for sure. And a couple other things too is causes. We have sciatica, which, as you guys know, is an irritation of the nerve that's leaving your back, going underneath your buttock, and then going down into your leg. And then spondylolisthesis, that's just a fancy word, what, Lauren, for when one vertebra is kind of slipped forward on then one below it?
Right, exactly. I mean, think about a bulging disc, essentially.
Yeah, and that's so a bulging disc will cause sciatica, and then the spondylolisthesis, that's when we get a forward slippage.
Yeah, that's more instability. And physical therapists are like really, really trained into exercise for that to create stability really through your muscles and strengthening your muscles, your tendons. So yes. And last but not least, we have scoliosis. We can most of the time blame our genetics on this one, but that's just an abnormal curvature of the spine, usually diagnosed through adolescence. And most live a very healthy lifestyle, but if work with a doctor, if the curve gets to be too much, there's physical therapy, bracing options. But that is a common cause of back pain as well.
Yeah, and don't be surprised if you get an x-ray at some point in time your back and you see this curvature of your spine. Do not freak out. I have scoliosis. I can play sports. I can not very good, but I can play sports. I can breathe. I can do everything I want. And obviously, though, if it gets to be, what is it, Lauren, like 35, 40 degrees or more of a curvature, that's when they recommend surgery. Yeah. Okay.
And that's only after you tried PT, bracing, everything. Your doctor will help you make that decision.
Absolutely. Okay. Well, at this point in time, we're going to take a little commercial break and hear from our sponsor, iMove PT. So we will be back in just about 30 seconds. iMove PT is proud to be the sponsor for the Healthy Habits for Active Aging podcast. iMove PT is a mobile physical therapy company based out of St. Louis, Missouri, and expanding throughout the United States. We bring a unique one-on-one physical therapy experience to the privacy, safety, and convenience of our patient's home, office setting, or the location of their choice. For more information about iMove PT, please go to www.imovephysicaltherapy.com or feel free to email us at info@imovephysicaltherapy.com. Have a great day. All right. Welcome back. And thank you to iMove PT for being the sponsor of the Healthy Habits for Active Aging podcast. Now it's time to talk about the fun stuff. And now that you have pain, what are we going to do to make this better? Before we talk about treatment, though, you should know that the statistic is that 2.6 million Americans go to the ER each year due to lower back pain. That is, wow, that's absolutely amazing. But the really sad part is that 60% of these people are prescribed opioids, and not everyone knows about the opioid crisis. I think we've got a little bit better handle on it now than we did maybe 5 years ago. But these are just highly addictive drugs that control pain. And these guys, you got to be aware of this. You got to make sure that when you take opioids, never take more than what the physician prescribes. And we really don't want you on those for very long. Lauren, any thoughts on that?
Yeah, I went to a continuing ed class over the weekend, and the doctors there were even talking about patients that have used prolonged opioids before they were to get surgery had worse results actually after surgery. Just because they're not, they're trying to get off the opioids. The doctors were no longer prescribing because now they're supposed to be healing, and they're just having much, much worse pain tolerance than had they not taken it. So I thought that was pretty interesting.
Gotcha. Okay. Yeah, again, I think that we have a much better handle on it now than we did a few years back, but I think it can continue to be a big issue. So let's talk about what Dr. Bennett and I feel is really many options for lower back pain, but we feel that specific physical therapy intervention is crucial. And so I want to just spend a minute or two talking about the different types of things that when you see a physical therapist, what that means, what it entails, or at least what it should entail. And then I'll talk about that. And Lauren's going to talk about a few other types of treatment options and concepts. But when you have lower back pain, depending upon the state you're in, sometimes you can go directly to a physical therapist. Sometimes you need to get physician orders. It just depends on your state. However, when you go see a therapist, the first thing that should happen is a very thorough evaluation to determine not just that you have pain, because we know you have pain, but what is the cause of it? And sometimes that's hard to really to know 100% exactly, but you want to go to a therapist that is able to do a complete evaluation and have a pretty good idea of, are we dealing with a disc herniation? Are we dealing with a nerve that's being compressed from arthritis? Are we dealing with a muscle strain? I mean, there's many. Are we dealing with fracture? Are we dealing with cancer? I mean, there's all kinds of things that can cause lower back pain, but before we can treat it, we have to know what the cause of it is. And make sure if you go to a physical therapist and they just do a 5-minute evaluation, then start you on exercises, I would like for you to get up, walk out of that clinic, and find somebody else. You want to find a therapist that takes a good subjective interview with you, finds out about what's going on, finds out what causes your pain, what makes it worse, better, all those things, and then does the evaluation and then talks through it with you. We want to make sure that every patient we treat has a better understanding of the cause of their symptoms after they leave our office than before they first came in.
Sure. And those thorough evaluations, they'll not only they look at your posture, they're looking at your hip mobility, your strength in your core, the muscles around your hips for stability. Like we went and talked about all those causes earlier. Physical therapists, we are movement specialists. Our job is to figure out what muscles are tight, what is weak, what are the postural deviations. And a lot of that will give you relief. And when it doesn't, there's a period in time where the physical therapist should know, okay, should be responding at this point. Talk about imaging with the doctor, something like that. And in the long run, that also saves healthcare costs of going to physical therapy first. Let's fix that before we jump right into the MRI or whatever it may be.
So. Yeah, so many patients that get an MRI, sometimes there is a need for it, but a lot of patients that get it, they get it because of what I might call failed conservative treatment, not thorough conservative treatment. So again, it's important just to go see a physical therapist that is going to take time with you. And the other thing that we haven't talked about is we want to know, your spine is just a collection of joints that run up and down your spine. And we want to know how those joints of your spine are moving. So when you see a therapist, you want to have one that actually is getting in there and seeing how those joints of your lower back are moving, because sometimes your pain is a big part of it is those joints just kind of freeze and lock up on you because you've been in so much pain. So if we can begin to mobilize those joints and mobilize the soft tissue around it, oftentimes just doing that and helping improve blood supply, and it's just so much good. So really try to seek that person out. But the biggest thing is go to someone that has time to work with you and that's very thorough in treatment.
We want you to understand your condition, what you should be doing, and how to prevent it from happening again. As because we said, up to 80% of people will have recurrent low back pain in the next 2 years. So I think I would say that just because that means you feel healed today, you finished your last physical therapy treatment, that physical therapist needs to talk with you over things to keep up with. Is important as well as part of the home exercise program. Doesn't have to be daily, but maybe a couple times a week stretching just to keep up with.
Yeah, it's we all have our problem areas. Some people have a bad shoulder, some people bad knee, bad neck, bad low back, whatever your problem area is. Well, there's a pretty good chance that problem is not going to 100% go away without you really working on it. So there will be a exercise and a home exercise component long term that you need to listen to your physical therapist and do what you're supposed to, because those that follow our instructions, it's just like when you get your car fixed and the mechanic tells you to do something every 3,000 miles, you should do it, or else the car is going to have problems again.
Yeah, you only get one body.
That's very, you can trade that car in and get a new car, but we are stuck with the bodies we have. So you got to make it the very best you can.
So there's a couple other more fun things. We're done lecturing you.
We're done.
For now. But mattresses, I get asked this question a lot. Should I have a soft mattress, firm mattress? What is best if you have low back pain? People that have actually changed or bought a new mattress, like 63% of people say that it actually helped their lower back pain. What is recommended if you have low back pain is a medium to firm mattress. The softer mattresses, you'll sink, and then you're laying all night. If you're a back sleeper, your spine is like curved all night in this flexed position, which is a more vulnerable position of the spine for things like herniations and stuff. So medium to firm is what we recommend.
And also, I would also say, Lauren, that people should not forget that they need to rotate their mattress, because if you have a mattress and you're sleeping in the same spot night after night, month after month, year after year, well, guess what happens? If you take your sheets of the mattress off, you'll see it starting to hollow out, sink down. So at the very latest, every year, put it in your phone as a reminder, but turn that mattress. A lot of times you can't flip it because maybe there's a pillow top on it or something like that. If you can flip it, great. But if you can't flip it, at least rotate it so your body's not laying in the same spot every year after year.
Good. Yoga. When I was writing this podcast, I was like, you know what? I'm going to do yoga tonight. Turns out I need to continue doing yoga because I'm not flexible at all. But it has been proven to be successful. So flexibility is key with the spine. Also, like I mentioned earlier, and Dr. Gorman may elaborate a little bit more, but if we're talking about bed rest versus non-bed rest, 100% research shows that walking relieves low back pain. Laying in bed, becoming more stiff, less mobile, less blood flow to the joints is going to be worse than walking.
Yeah, and especially if you have a disc problem, your disc will not be, your back will not be happy with any kind of prolonged sitting. It'll be much happier when you're up moving around, or if you're laying on your back, that's fine too. But okay.
Yeah, and I would say just don't avoid. You don't want to avoid things. You want to avoid the things that hurt, but don't avoid activities out of fear. That's also a really, really main component as well.
All right. Next, we're going to talk about.
So last today, we would like to just go over, we do consider them as physical therapists. We call them red flags. So these are just kind of, we cannot reproduce the pain. Like the symptoms are just kind of all over the place. But if you're experiencing unexplained weight loss, night sweats, fevers, just pain that doesn't seem to come and go, just kind of always there, loss of bowel and bladder, some neurological symptoms, please call your doctor or discuss this with your primary care physician sooner rather than later, just to run any some necessary tests. There's always the risk of cancer or something like that, but those are symptoms that would warrant a definite call to the doctor. So we would like to recap today. It was a lot of information, but we appreciate you sticking with us through it all. About 80% of people are going to experience low back pain at some point in their lifetime. And as you learned from today, there's multiple reasons as to why this low back pain, but most people cannot pinpoint exactly what it is. But most low back pain should disappear on its own within 6 weeks, or with the care of a physical therapist or doctor as well. Understand your red flags we just talked about is an immediate call to the doctor. We want to be able to say that, my symptoms get better with blank, or my symptoms become worse with blank. That's the stuff us physical therapists are looking for. If it's just always the same, unexplained, we need to dig a little deeper into that. Last but not least, please avoid a sedentary lifestyle. Dr. Gorman and I encourage exercise, walking programs, exercise at least 3 times a week. So my last saying, don't avoid activities out of fear, but avoid activities that cause an increase in pain.
Absolutely. Well, again, we thank everyone for joining us. We know that you have so many options to spend your 20 to 30 minutes every week, but we're blessed that you spend that time with us. If you have any questions, if you have any comments, maybe for future podcasts, email us, please, at info@iMovePhysicalTherapy.com. We're excited about next week. We're going to talk about something that maybe many of you have had, whether it be in your lower back or in different parts of your body, but that's a cortisone injection. And we want to talk about pros and cons. Should you get one? When should you get one? How many should you get? Lauren and I both have a ton of experience working with patients that have had these injections. So we want to share some of our knowledge with you, but thank you all so much for joining us. And we hope you have a great week.
Thank you. See you next time.
We hope you've enjoyed this episode of the Healthy Habits for Active Aging podcast. If you have any questions for Dr. Gorman or Dr. Bennett, please send an email to info@iMovePhysicalTherapy.com. To learn more about healthy aging, visit our website at iMovePhysicalTherapy.com. Like what you hear? Be sure to rate and subscribe. See you next week.